Okay.
All right.
Good afternoon,
Yes.
all of you beautiful viewers out there during the coronavirus crisis. And to my beautiful co-host, Alicia, how are you?
I can't complain. I really cannot complain. Just hanging in there like the rest. Thank you. Well, ditto. Hanging there like the rest of the world. You know, it's a new week. Stuck in the house. But as you said,
Yeah.
just hanging in there, taking inventory of what's important and trying to not get cabin fever, although it's kind of difficult.
Yep, this has become the new normal. I just wanted to thank
Mm,
everyone again for joining us on the Society Survivors show,
yes,
especially this week's episodes dealing with mental health during the coronavirus crisis.
indeed. Yes,
If you have already viewed our past episodes, or if you haven't viewed our past episodes, please make sure you catch up with them
yes.
on our Generational Survivors page. It's on Facebook. You'll
Mhm.
see the links there. You'll be able to
Yes,
log right on in and catch up on the previous episodes that you missed. So
absolutely.
we definitely want you all to
Catch
keep,
up.
that's right, catch up, stay with us, because we're definitely moving forward. And like I said, this week's episodes on the mental health crisis during COVID-19, these are going to be some super episodes you don't want to miss. On Wednesday, we have a special guest that will be joining us. And I cannot wait to just, you guys are going to love her. She's
Yes.
such a beautiful person. Am I right, Alicia?
Yes, and we'll be telling you towards the end of the show who it is.
Yes.
To stay tuned to listen to who it is. Don't skip, okay?
That's right. We don't want to give it away too soon. Then you guys won't tune in for the rest of the show.
Exactly. You should, because we got some heavy stuff to talk about today. Yes.
Yeah.
And on that note, as Sadia said, we're devoting this week to mental health. There's a lot of challenges, and some of them you're probably not even thinking about. But I do want to give the following disclaimer that's true for all of our shows. Any information on diseases and treatments available discussed on this platform is intended for general guidance only and must never be considered a substitute for advice provided by a doctor or other qualified healthcare professional. Always seek the advice of your physician or other qualified healthcare professional with questions you may have regarding your medical condition. And to the extent permitted by law, generational survivors and all participants of this platform shall not be liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access or use of any content available on this platform, including viruses, regardless of the accuracy or completeness of content. So, with all of that being said, the two of us recently were, and you may not know, two of us recently trained as peer recovery specialists.
That's right.
So, when we were thinking about mental health challenges and coronavirus, those are the first people that came to mind. One of the first people I should say that came to mind. And since we're in Virginia, a beautiful article by the Richmond Times and Dispatch titled Isolation Could Exact Toll on Those with Mental Health and Substance Abuse Problem in Virginia. I'm going to give you just some information because it's very important, because probably the same is true and it may be worse in the state that you live in. One of the biggest resources in recovery is group meetings. We know that. These are important not just for accountability, but so that people know they're not alone and they have support, and they continually keep that at the front of their mind. But as the article points out, with coronavirus, you have many people in recovery, or they're being people that are normally treated for mental health issues are staying home, isolated, their meetings are postponed, or they have shifted to phone calls and online video chats. And I know for some of us, just like we're on this platform, Zoom today, but some of us are not that great with technology. And
right. I'm not. I'm one of those.
And even if they are great with technology, it may not feel that need that they have to meet people in person and communicate in person. So we have a problem. And we're already dealing with the disease of addiction, said Hantelman, which is a peer recovery specialist at the Substance Abuse and Addiction Recovery Alliance of Virginia. They're also known as SARA of Virginia.
Yes.
Bring in coronavirus and quarantines and kids out of school and not being able to find toilet paper. The added stress and anxiety could lead to relapses, sending life spiraling further downward during a pandemic, and being poor or homeless and also isolated can be deadly for people who can no longer see others in person for treatment and therapy. And for people in recovery, there's a higher risk of returning to substance abuse, according to the mental health experts. So again, if you think of the regular challenges and stressors that everyone's dealing with, and you add to that someone that is fighting to stay well and stay healthy and recover, and you add this to it, it's a problem.
It definitely is. It's a huge problem for people dealing with substance abuse, mental
Yes.
illnesses, and they're in recovery right now. That could really set them back.
Right.
And especially during this time, during the isolation periods where they cannot really reach out and they can't be in meetings, group meetings, and different things like that. So,
Exactly.
what do we do? And
Mm,
I know that there are a lot of mental health providers trying to provide those tools. But
yes.
like you said, Alicia, what if they're not able or technically sound as others and they're not able to? I know just from my church members and just speaking out of context here, so a lot of them did not know how to access the Zoom.
Right.
So you're talking about people who've never really had to rely on technology this heavily as far as meeting and talking with their therapists and things like that. So what happens when that person can't access, or maybe they don't have access to a computer? Their only access to a computer was at the library. The
Right.
library was
Coffee
closed.
shop.
Coffee
Going to
shop.
work.
Right.
Wi-Fi.
Absolutely.
They don't have it at home now, or maybe
Absolutely.
expenses they had to cut.
Absolutely. This is definitely a huge problem. I know that dealing with mental illness is not something that is cured like that. Like you
No.
always have it, but you know how to handle it
Yes.
when getting the proper help for it.
Exactly.
So now that we have been self-quarantining and in isolation, those people who really need those group sessions and really need their peer support specialists really need to reach out to their AA person. What happens to them? you
Right.
know what happens amidst this crisis? We already know that the suicide rate has went up.
Yeah.
you know uh So this is definitely a crisis. This is something that it's near and dear to my heart as a
Yeah.
person who definitely, I have been diagnosed with a mental illness. I do receive therapy, but unfortunately they're overwhelmed where
Yeah.
I receive therapy at. So they have yet to be able, they're not able to reach out to me as of yet. Um,
And let's be honest, we know there were problems with the system for mental health anyway. I
Absolutely.
for coronavirus, there's always been issues with mental health. For those that are brave enough to say, I need help, um, system's broken. It's hard enough to fight through the stigma of mental illness and
Mhm.
to get help. And then you go to get help and there's all this red tape. One of the things I've always said is that every therapist isn't for everybody.
Right.
Going there and trying to get the first therapist, there's some red tape in that system when you need help. So the system was broken anyway. Sometimes there's a lot of resources out there that would be great for you, but you just don't know about them. And trying to find all of this stuff when you're at your most vulnerable and you need help. I say it's like you have a gouging wound and you're bleeding and just bleeding. You can tell me all the things out there all day. I need help right now. And sometimes, depending on the access you have or the awareness you have, my right now help is not blazing in front of me. So the system already had problems. And now you're adding a coronavirus epidemic you're adding the stress, you're adding the this. Matter of fact, that article said that the person was quoted, said, one alumni killed himself last week. And this is from John Schinshosler, who's the head of the McShin Foundation, which is a foundation founded in 2004 to help people that are recovering from substance abuse. And he said, I'm quite certain it was definitely related in part to the crisis. And so he said that you're going to see a lot more suicides. I guarantee you that. Where we are holding the line, we are at a battle station emergency right now, but even holding the line, there's still going to be cracks in the line.
Wow.
What we're talking about. And, myself as a child abuse survivor, I know what that's like. I know that plague of suicide. I know the constant contemplation.
Yes.
I always share with people, no one really wants to die. No one wakes up and goes through some things and, society say, well, this person's so weak. No one really wants to die. The problem is they have no hope. And the pain of what they're going through, they want to get rid of it. So
right.
See no other solution but to die. That's where you see suicide being an option to them. So suicide may seem like the way out, but it never is. We both know that from experience. And neither are the other coping mechanisms that are used.
Absolutely.
Lead to an unclear thought process, such as drugs and alcohol. And I have to mention this, Saudia, because I know in Virginia, we were looking at some of the other states and they immediately were shutting down their ABC stores. Alcohol to them was not essential, so we're shutting them down. Employees, even here in Virginia, you have some ABC store employees that have come down with coronavirus. So for the safety of the employees and because they felt it was not essential, they were closing shop. Virginia didn't do that. Virginia did the ABC stores as an essential resource. And a lot of people here were just a little hot over that. At one point I had my issues because I'm like, now you want to close down church, but you don't want to close down ABC store. But here's a consideration that they said, and that was the fact that with all this going on, if they close down the ABC stores, there are a lot of people that are using alcohol to cope. So if you shut down the ABC store, and I'm not saying you have to agree with this or not, but that would put them in a greater distress medically, which means that you would see certain people flooding the medical systems, going through withdrawal, some of them even going to the point that they might need to be put on ventilation. And we know right now, those resources are being occupied for those that have the
COVID-19.
So it was like, in part to prevent the overload, people need their alcohol.
It's a twofold, like you said.
Yeah. That's not the only reason, but
Right. You really don't want to advocate for ABC stores because I really don't feel like during the time of a pandemic situation where people need food, water, and other things for survival, that the ABC stores are at the top of my list.
They're not mine.
they're really not at the top of my list. I feel as though, we may see a spike in those if they were to close down the ABC stores in its entirety. This is just my thought that you may see a spike in those individuals going through withdrawal who rely on alcohol. That's their coping mechanism.
Right.
But it might also do some good to some folks.
Oh, absolutely.
You understand? They'll have to find an additional way of coping, and hopefully, and this is, we're not saying this is going to happen, obviously they're not shutting down the ABC.
We're just looking at it from a different perspective.
But just looking at it from a different lens, I feel as though they need to be shut down because I don't feel like ABC stores are essential. I feel like they will add to the problem. And the reason why I say that is because those who weren't utilizing alcohol as a coping mechanism before, these people are now being shut in. We're not talking about just the people who have been diagnosed with mental illness. Now
Right.
we're talking about the people who haven't been diagnosed, who
Right.
don't know how to deal with anxiety and depression during COVID-19, and they're being faced with it. So
Right.
now their coping mechanism is, man, I can't go to work. I'm in here with these kids all day. I need me a drink. Whereas before, they weren't relying on those things. Work was their outlet, going out, being able to hang out with their friends or socialize in different
Mhm.
ways outside. That was their outlet. Now we have to stay inside. We're isolated. So even those who weren't diagnosed with mental illnesses, they're experiencing a lot of anxiety and depression. Those who are not, this is not common. This is not common for the everyday
Right.
person. So now you're talking about, I'm sitting in the house, and now how do I cope? I might turn to alcohol, whereas before I was only like a social drinker. I drank
Mhm.
on occasions. Now it's like it's become an everyday thing. So I feel like that's just a catch-22 there. And I don't really feel as though ABCs are essential. I get it. I get what they're doing. Um, but that's my take on it. I say shut it down.
I said that initially, but I sort of changed my mind. And I tell you, this is what changed it for me. Um, well, number one, we can't police anything. So
Right.
same thing, if I take away liquor, you'll eat too much. We're not shutting down grocery stores. How many people already said they gained pounds because they keep eating? So I mean, if we want to police things,
Oh gosh.
turn to something to cope and using excess. I mean, hey. But I think what really turned me around on that, and again, I'm not saying I'm pro whatever. We all have free will. We know that in anything you do, regulation or not, someone's going to use it to the excess and hurt other people. But here's one consideration I thought about in our state is that they start allowing you to have alcohol to go at restaurants.
Mm-hmm.
That is a bigger concern to me than the ABC store. Because
Right.
my hopes is if you go to an ABC store, you're getting what you need and you're going home.
Mm-hmm. Mm-hmm.
Having you take out liquor from a restaurant with your meal to go, how many people are going to drink that container while you're driving home?
That's true.
So I'm just like, when you're policing that people can take out liquor, and I think from what I read, it's only wine and beer. It doesn't matter. To me, that increases drunk driving. Whereas I would hope a person that's going to drive to the ABC store is going to get their container, take it home, and fix their beverage however. So at
Mm-hmm.
this point, I'm like, hey, they've shut down. I think they reduced the hours, but it's available. Do what you got to do. Because for me, I'm more alarmed by the fact that you can now go carry out liquor. I don't get that. Especially when, I mean, to me, that just makes it so much more casual. So people have their little container, they're taken out. I don't trust that you're not going to pop something open and drink it right there while you're going ahead. Because how many people order something to go and you're eating in the car?
Right.
Why not have your beverage with your food? So I'm like, in all things, be responsible and think about the safety of others. But this just shows that there's a plethora of considerations when it comes to the coronavirus, when it comes to issues that people are dealing with, especially in a pandemic. And another thing you think about is those essential personnel and what they're dealing with. I mean, let's be real. We're seeing even on Facebook, different people that you know of who are losing loved ones or panicking because this one has been diagnosed with coronavirus. But think about those people that is their life and death decision.
And that is a
Profession.
that is definitely near and dear to
So
me,
how are they holding in?
because I have a sister and a brother. I have my sister, my brother-in-law, my
Yeah,
sister-in-law, they're all medical personnel. My nephew, he's a paramedic and a firefighter. I have my sisters in blue. I'm retired law enforcement, and I keep
exactly.
in close contact with my brothers and sisters in blue. And, they're first responders. So
Right. High
they're
stress
dealing,
anyway.
it's very high stress. It was always a high stress atmosphere
Exactly.
to begin with. So now with this, and to learn that a lot of our first responders don't even have masks and gloves when they're
No.
going into different situations is alarming.
Yes.
And they can't exercise the social distancing and the,
Right. Virtual meeting.
they can't exercise that, because when you're arresting someone, you're right up on them.
Right.
Sometimes it's a
Boots on
struggle.
ground.
Absolutely. When you have a doctor and a nurse examining a patient, you're right up on them. You understand? So that to me is very alarming. This disease, a lot of people have said that this COVID-19 is false.
Right.
It, it's not. It's something that the government made up. It's this, it's that. I've heard so many different theories, and I was really upset to learn that people are not taking it as serious as they should. This
And
is a
even
second,
if you want to do conspiracy theory,
right?
fine. Hold on to your conspiracy theory. The fact is, people are infected and people are dying.
And people are dying.
Plot by the government, whether it was a plot by another country. However you think coronavirus started, you're free to that opinion. But
Absolutely.
people are being infected and people are dying.
And people are dying.
The issues at hand.
I know there are two people close to me that have COVID-19. So it hit home for me. It
Yeah.
hit home. Two
As a
people
matter of
that I know.
fact, before we went on this broadcast, a lot of times when we're doing broadcasts, I try not to read things right before to deal with this
Right.
because it puts you in another mindset. But I looked on and found there's an acquaintance who was so emotional because someone she knows personally died from this illness. And then she was mentioning another person whose fiance died. And it was an article I saw last night. I didn't put this on the page, but this is how serious this is. A husband and wife decided to celebrate their anniversary, and they obeyed the rules. They had less than 10 people at this celebration. It was their home. They invited them over, and I think it was less than 24 or 48 hours. He was sick.
Mm.
The husband, they put him on a breathing apparatus because he couldn't breathe. And of course, you realize once you are given treatment at the hospital, your loved ones and you are separated. So
That's right.
hold your loved one's hand or, baby, I'm going to be right by your side. You can't. You have to go. And now you quarantine, but they have to get treatment in the hospital. I want to say it was probably 24 or 48 hours later that he died.
Mm.
Healthy man. I think they were in their 40s. So her thing was, like so many people have uttered before, in hindsight, we just wouldn't have had anything. Forget the 10, less than 10 rule. We just wouldn't have done anything. It wasn't that important to have that anniversary dinner. So, again, err against caution. I see in a lot of states, including ours, people are trying to take the regulations or they're trying to bend the law. I understand social distancing. There's time you have to go out. But as much as possible, just stay in. Because the other countries that went through this before us will tell you that was the mistake they made. They didn't take it as serious as early as they should have. They were still doing a lot of the activities that they were used to doing, and it was too late.
Absolutely.
It was too late. So use caution. But the same thing, Saudia, as we're wrapping up, I know that there was something else too we were talking about those in the fields and the healthcare workers. There was a study, and I'll say all of these things we're sharing with you from articles are on the Generational Survivors page on Facebook. So we have those things posted so you can read and get more information as well. But it was a new study examining the mental health of nearly 1,300 healthcare workers in China who dealt with COVID-19 patients. And the research looked at symptoms of depression, anxiety, insomnia, and distress. And what they said was, while they acknowledged that protecting healthcare workers is an important component of public health measures for addressing the COVID-19 epidemic, the study found specifically frontline healthcare workers were 52% more likely to have symptoms of depression, 57% more likely to have symptoms of anxiety.
Wow.
8% more likely to experience distress, and almost 3 times as likely to have insomnia than those who were not on the front line. And furthermore, 18% of frontline healthcare workers who experienced depression had a severe form of the condition.
Wow.
Form. These are the people that do not have a choice to stay at home. These are the people that are holding our life in their hands if we're sick, if our loved ones are sick from this virus. And you have to remember that some of these people, most of these people in this epidemic, are serving long shifts, getting a few hours sleep, going right back to it without the proper protection equipment, and literally are making the choice of who lives and dies every day. Now tell me that doesn't have some type of mental health challenge or impact on their well-being.
Absolutely. Absolutely. And this is all about mental health. Those numbers are alarming.
Yes.
And Alicia, I just want to continue to encourage our viewers to view the Facebook Generational Survivors page,
Yes.
because we have plenty of links. And one of these links is to a guide that NAMI, which is the National Alliance on Mental Illness, has produced, especially for those dealing with mental health challenges during the coronavirus. Okay,
Right.
so please go on the page to view those links. We can't not stress enough, and I'll say it again, we cannot stress enough that there is help out there, and preparation and planning is so important. They're so important. There are hotlines, there's virtual assistants out there, so you don't have to feel alone when you need to seek help, especially during these times. I mean, I understand that, you would rather be in the presence of someone, but these are the times moving forward that we definitely have to kind of succumb to what we have available to us at the moment. And as a matter of fact, NAMI's guide has helpful tips and resources, including if you need paying your bills, if you need insurance for mental health, or if you need help and don't know where to turn.
Yes.
Check out NAMI. They definitely have a lot of tips and suggestions for those of us going through. Knowledge. Let me just give y'all some tips here. I just want to share this with you really quickly. Knowledge is power, but I want to add to that further. Applied knowledge is power. You see, if you don't apply it, then you're not really utilizing your power. Right. So applied knowledge is power. Understanding the facts that affect a person's immune response to COVID-19 will matter as much or more than understanding the virus. So know the facts. Don't listen to the conspiracy theories. Know the facts. Don't accept and read everything you hear. I've said that from the beginning. My co-host has said that from the beginning. Look beyond the rhetoric and arm yourself with true information. Centers for Disease Control. I've said this time and time again. Centers for Disease Control and Prevention, the CDC, will provide the information and the facts that we need. They frequently update you on their website, frequently. So you just need to go to their website to get the facts. Number 3, get your emotional support system in place. Very important, people. Very important. If you've never thought about your emotional stability, you have to now maintain familiar routines in daily life as much as possible. Take care of your basic needs. Employ your helpful coping strategies. Rest is very important. Let me tell you something. I binged 3 nights in a row one night, 3 nights in a row watching Netflix. That was not healthy at all, because I stayed up until maybe 5 o'clock in the morning. And the next day, that day, I felt my immune system felt like it was going down. You understand? And it was. Rest during work, between shifts, eat healthy foods, and engage in physical activity. Take a walk. You got a backyard? Take a walk in your backyard. Please exercise social distancing. Stay connected with others and maintain your social networks. When I say stay connected, there's Zoom, there's Facebook, there's Instagram, your TikTok, whatever you do. Have the emails and phone numbers of close friends and family there, accessible at your fingertips. Stay
Right.
connected via email, like we just said, social media, conference lines, and find a free online support group. We do have those available to us. There are free online support groups. Number 4, take control and incorporate preventative measures. Wash
Wash
your
your hands.
hands. Say it, Alicia.
Wash your hands. You know
Wash
your mama
your
told you that.
Hello, wash your hands. See the CDC's list of preventative measures.
Yes.
Okay, avoid watching, reading, or listening to news reports that can cause you to feel anxious or distressed. Meaning, they're saying you should only watch 2 newscasts a day.
Twice a day. Just
Twice a day. That's all you need. You don't need to be watching the news every hour upon the hour, breaking news, and you on your phone looking at the news there, looking at the news on Facebook, looking at the news on every news station. No. You don't need to do that. That's going to cause your anxiety to rise. Okay. So let's be aware of how we're feeling on a mental level.
Yes.
Take in consideration your mental health and your children's
Mental health.
If you have children.
Mm-hmm.
Okay, very important. Very important.
And that's the thing I want to say about this platform. We're bringing the information to expose those who may not get as much media attention. We're giving you the information to have you think differently and see where you can be of help or get help. But we're not doing this to depress you. We're doing this so you're aware, and then we're always giving you those resources and support so you're empowered. You don't have to sit here. I know with viruses and things, people feel like, I'm just waiting for maybe I'll get sick or somebody in my house. No, prevention and planning is everything, not panic. And Saudia has said that from the beginning of these broadcasts. Prevention, planning, preparation, not panicking. So quickly wrapping up, we just have about 2 minutes here.
Yes.
So stay tuned. Wednesday, we're having an amazing person who is not a stranger to either one of us. And we told you we would tell you who it was. It is Alicia Amsler, who is the director of the nonprofit One Way to Life. And One Way to Life's mission is to encourage people to engage in conversation on mental health and suicide awareness, provide resources and education. Her and her team are doing a phenomenal job. So we definitely want to talk to her. She's even found a way to take beauty and fashion and incorporate it in a platform that allows people, not just in that industry, but overall, to be educated and not have the stigma of mental illness, but get help. And here's where it's also a double duty to interview her, because she's a salon owner.
Right.
She owns Alicia's Salon and Day Spa. So, of course, with coronavirus, she has had to close her shop. So you want to tune in and you want to hear how she's viewing things, how she's pivoting her business in coronavirus, but how she's keeping her mental health and wellness, as well as looking out for those with her platform. So you have got to tune in Wednesday at noon. That information will be posted shortly, so you can schedule the live and our Zoom conversation and have it on your calendar. So make sure you stay tuned. And as we always say, bye-bye for now.
Yes. Prayer, preparation, and preventative measures. See you on Wednesday.